Again, it's Anthony here at CARP headquarters. I'm the Chief Operating Officer at CARP, and we'll get this meeting going in just a few minutes. Our panelists are standing by, and our registrants are just starting to fill up our room right now. You're welcome to go into the chat function and let us know where in the country, or perhaps somewhere warmer, that you're looking in from, and use the chat function and let us know. And that's where we will be asking you to submit your questions, should they come to mind. And I will be following along in the chat and sharing your questions with our panelists. So please stand by. We'll get started in just 3 or 4 minutes. Thank you. Hello, it's Anthony Quinn here in the CARP National Office in Toronto. We're just about ready to get started. I'm inviting our panelists, Bill and Molly, to join us on screen. Once again, we'll get started imminently, and I would like to welcome those of you who are just logging in now, and thanks to those of you who came a little early. You're invited to go into the chat function of your Zoom screen and share with us where in the country you are looking in from. And that's a great way for us to get a sense of who the audience is. And that's where we'll be asking you to share any questions you have for our panelists. A reminder that our panelists can't answer your individual medical questions, but certainly welcome general questions on the topics and the things that are on your mind as they're going through their presentation. So Bill, with that, I'm going to hit the record button, and as soon as you hear that, I will go back into the background, and I will be standing by monitoring the chat questions and controlling the functionality. If I'm needed, Bill, call me back, and when it's time for the Q&A, I'll be joining again. So with that, Bill, I'm going to record. And over to you, Bill.
Great. Well, thank you very much, Anthony Quinn. And Anthony will be watching for your questions that you're putting in the chat. And Molly and I will do our best to answer them when the presentation is over. And as Anthony said, this event will be recorded, so you'll be able to see the recording, share it with your friends and neighbors. Everyone who is registered will get an email telling them where to find the chat. We'll also post it on our Facebook site and on our carp.ca website. So welcome everybody from across the country. Hundreds of you watching in from one end of the other. Hello to my friends in Newfoundland on the one end and to BC on the other end of the country. I'm very glad to be talking to you today from sunny Nova Scotia. The sun is shining here. I hope it is where you are too. I'm going to be introducing my fellow panelists a little bit later to a larger extent, but she is Molly Yang. She's a pharmacist and Director of Pharmacy and Innovation and Professional Affairs at Whole Health Pharmacy. And I'll talk more about Molly's background later. You know, vaccines and vaccination is one of CARP's key advocacy issues because we know that it's essential for maintaining good health as we age. We know that one of the best ways to take control of our health is to protect ourselves and our loved ones, and to keep up with the NACI recommended vaccines, the big five as we call them: COVID, influenza, pneumococcal, including pneumonia, shingles, and RSV. Those are the five that are most harmful to seniors and most preventable for us if we'll get our vaccinations. However, provincial funding across the country varies from province to province. That means that certain vaccines may be available in one province, but not affordable to those who need them most in another province. CARP believes all older Canadians should have equitable access to the most effective expert-recommended vaccines. You know, the public health crisis may have seemed to be over, but unfortunately, COVID is here to stay. And CARP believes it's time for older Canadians to make sure that those COVID vaccines are simply a part of our ongoing health routine. We can get them at the same time we get our flu shots, and the updated vaccines are now available in all provinces to people who need them and those who are over 65. So it is time for you to reach out to your pharmacist or doctor now to make sure you get yours. To find out more about how our members felt about vaccinations, CARP surveyed its membership last August, and the findings show that a majority of our members prioritize their health and that of others in context of COVID-19 and other vaccinations. The majority also have had a very positive experience with immunization and prefer to receive their vaccinations in pharmacies and believe the government is responsible for funding these expert recommended vaccines. We had almost 3,000 responses to that survey, so it was very robust. 94% of those who responded had had 3 or more boosters. 85% know that you can get both your flu and your COVID vaccines at the same time. Over 80% are concerned about the high risk of COVID for them and their families. 96% believe government should cover all expert recommended vaccines for seniors. 70% of the people said they preferred getting them at the pharmacy, 19% at public clinics, and interestingly enough, only 9% found it most convenient to get it from their doctors, and that may be because so many people don't have a family doctor these days, but they do have easy access to their local pharmacy. So, as you know, one of the best ways to take control of your health, protecting both yourself and others, is to make sure you get those vaccines. In that regard, Molly Yang is going to speak to us now in more detail and give us the information we need to know to make these decisions more accurately for ourselves. Molly Yang received her Bachelor and Doctor of Pharmacy degrees at the U of T, and as a leader in pharmacy, her work in education, consulting, and research has focused on adult immunizations, respiratory health, diabetes, and health reduction. She develops educational and clinic programs for over 240 independently owned pharmacies nationwide as a part of Whole Health. And she's the co-founder of VaxCare Innovations, a nonprofit supporting adult immunizations, awareness, and uptake. She received her the 2023 Emerging Leader in Pharmacy Practice Award from U of T. She's in Ontario and a part of the Pharmacists Association's New Practitioner of the Year in 2024. So with that kind of introduction, Molly, we're really looking forward to your presentation. CARP members, here's Molly Yang.
Thanks so much, Bill. And thank you so much, CARP, for inviting me to this session. It's so great to see so many individuals on the webinar today from all across Canada. Oftentimes, you know, it becomes challenging when it comes to vaccinations to keep that interest up and going, especially post-pandemic, when I know a lot of people have experienced a little bit of that vaccine fatigue from those multiple vaccinations. So I really do encourage you to continue with that spirit in following up with vaccines and keeping updated, because it's constantly changing. And I'm happy to be here today. I have a couple of slides, which I'll go over in just a minute, but I do encourage everyone to be to put your questions in there. I want this session between Bill and I to be more of a discussion and answering some of the key questions that you may have about those big 5 vaccines that Bill mentioned earlier. In terms of vaccines, they are the number one thing that you can do to protect yourself against vaccine preventable diseases. And especially for older adults, it is so important, because we're not just talking about that acute infection that you're thinking about. Like, you might think back to, all the years past where you had a cold or you had the flu in the past. However, as you get older, you really have that increased risk of having more severe disease, having to go to the hospital, to go wait in that emergency room. And we know that, especially as the respiratory season progresses here, there can be times when our systems are at their limit there. So with that, why don't I'll present my slides. Let me just share my screen. Give me one sec. Okay, I hope everyone can see my screen. Please let us know in the chat if you're not able to see the screen, and please put your questions in there as well. As mentioned,
looks like everybody can see it, Molly.
Okay, wonderful. Thanks, Bill. As mentioned, I only have a couple of slides, but I really want to reinforce those big 5 vaccines that older adults should really be thinking about at this stage in their lives. Oftentimes when we are in respiratory season, which is between this October, November, all the way to March, April timeframe, we often have only thought about flu, and in the past few years have only thought about COVID, which everyone point blank should be receiving, but especially for older adults where, during respiratory season, it's not just COVID and flu that are circulating. It's also these other harmful respiratory viruses that are just as dangerous as some of the conditions that are more in the news. So we definitely want to also think about pneumonia vaccine. Everyone over the age of 50 should really be thinking about getting their pneumococcal vaccine. If you have other comorbidities, even under the age of 50, you should also be thinking about pneumococcal vaccines. Pneumococcal pneumonia can lead to hospitalization. It can lead to ICU, and it can lead to death as well in very severe situations. And overall, for all of these respiratory viruses, which are COVID, flu, pneumonia, and RSV, and then shingles is not a respiratory virus, but we do want to protect against that in older adults as well. But overall, for respiratory illnesses, we want to really prevent that initial infection from occurring, because it's been shown in the research that after you have that initial infection, there can be functional decline, and that initial infection can impact you so much that you might never be the same. And as you get older and older, your immune system will age and your response may not be as strong. And then as you have these cumulative infections over time, it becomes a cycle where you're more likely to get that infection, and then back to the beginning where you're at that increased risk as well. So for a pneumococcal vaccine, we're of course recommending for everyone ages 50 plus. In terms of the product that's available, in the past, you might have received something called Prevnar 13 or Pneumovax, either from your physician or from the pharmacy. There is a newer vaccine that came out just a couple of years ago called Prevnar 20. So for individuals who had previously received, especially if you received Pneumovax in the past, I would definitely recommend you to get that updated vaccine now, either Prevnar 20 or Capvaxive, which are the newer vaccines. And these have been shown to have that longer and stronger immune protection compared to Pneumovax, which was used in the past. There's also RSV, and with RSV, We heard a little bit about it in the news last year, but I find recently this year the messaging around RSV has been slower in the news. There hasn't been as much interest in it, but that doesn't mean that your risk is lower. So definitely, if you have not yet received your RSV vaccine last year, please consider RSV vaccination for individuals 50 plus. There's a product that's available for ages 50 plus called Arexvy. And if you're ages 60 plus, there are 3 products that are available: Arexvy, Abrysvo, and Mrezvia, which is the new Moderna product. It is approved now in Canada, but we probably won't see supply of it coming in until early 2025. But those are the options that are available. With RSV, we do see similar risks to older adults as we see with flu. So what we're really trying to prevent here is that severe infection, which especially for adults over the age of 65, over the age of 75, we do see significant morbidity and risks to those high-risk infections, and that can lead to, as mentioned before, hospitalizations, ICU admissions, intubation, and death as well in severe situations. So, of course, if you previously received Arexvy last year, because many of you may have received RSV vaccine last year, it is a multi-year protection. So if you received it last year, you don't necessarily need another dose this year. But if you have never received an RSV vaccine before, I do really recommend that you consider it. Speak to your healthcare provider, whether that's your pharmacist or your physician, about that. And then I've also included shingles on here, which is part of the Big Five, as Bill went over. It's not necessarily a respiratory vaccine. So there's not, compared to the other ones on here, which there's higher risk at this time of year. With shingles, there isn't too much of a higher risk at this time of year compared to other times of year. Shingles is a reactivation of chickenpox, and because the virus lives within your nerves, and that it reactivates during, could be triggered by stress or other other factors to form that painful rash that many of you have either probably experienced or have seen in a family member or a friend, and it's extremely painful. What we're trying to prevent with the shingles vaccine is preventing that reactivation and that rash. So everyone ages 50 plus, or if you're immunocompromised or with a weakened immune system, age 18 plus, then I definitely recommend shingles vaccine for you as well. And as Bill mentioned earlier, all of these vaccines can essentially be given together at the same appointment. And I know, 5 vaccines can be a lot to give together, but we do really want to prioritize, especially the respiratory vaccines, to make sure everyone's protected in advance of the spike that we usually see with some of these respiratory viruses and bacteria. As weather starts getting colder, and as we have holiday season coming up, and you're going to be with your family members, right? You are going to be around young children and infants that maybe don't have the same level of protection as an adult would, or are unable to get vaccines. You might be around other older individuals or other individuals who are at risk. We really want to prevent that transmission in protecting ourselves with these vaccines, but also protecting our families. And we do, as I mentioned, usually see that peak in some of these infections in that early December timeframe when people are having those get-togethers and we're staying at home because of the cold. So, Bill alluded to it earlier, but there are differences in provincial funding across these vaccines. And I've listed it at high level here, but for COVID and flu in general, most provinces across Canada will fund it for individuals 6 months and older. In terms of whether or not you're able to get it at the pharmacy, that depends. So in certain places, for example, in Ontario, we are only able to vaccinate in pharmacy for the flu vaccine individuals age 2 and up. For COVID, it's age 6 months and older, and in other provinces, it differs as well. But As long as you're 6 months and older, you can receive it at no cost. For older individuals, there are versions of the vaccine that are more tailored to your needs. So there's a high dose version of the flu vaccine that will be able to generate a stronger immune response for you to protect yourself from the flu. There's also an adjuvanted version of the flu vaccine that is available. It may not be covered in all provinces. So depending on where you are and where you go, sometimes if you go, they might not have supply of that high dose or adjuvanted vaccine. In those scenarios, the messaging is that as long as you're able to get a vaccine today, regardless of the one you get, that's the best flu vaccine for you. So even if the high dose or the adjuvanted flu vaccine is not available where you're at today getting vaccinated, it's still okay to get the standard flu vaccination to protect yourself. And then with COVID, as we mentioned before, there's the both the Moderna and Pfizer products that are available. With Moderna, it is the only one that can be used in ages 6 to 11. And then there's another, and then it can also be used for age 12 and up. Both vaccines, both Moderna and Pfizer, can be used for age 12 and up. For pneumonia vaccine, there's coverage for pediatrics, and then across provinces, there's usually coverage for older adults age 65 and older. For RSV, it gets a little bit complicated. I have a following slide with more details. And then for shingles, it gets a little bit complicated as well. It's not as well distributed as pneumonia and COVID and flu. There is coverage in certain provinces, which I've listed here. And sometimes that comes with conditions. If, for example, in Alberta, if you have solid organ transplant. In Ontario, which I think based on the comments most individuals are calling in from, there is coverage age 65 to 70. And actually, because of COVID, it includes age 71 to 75 until the end of this year. So if you missed your Shingrix vaccine, your publicly funded Shingrix vaccine because of COVID, and you're within age 65 to 75, please get it. If you're 71 to 75, make sure you get both doses before the end of this year. And then across Yukon, PEI, Quebec, and Alberta, there is some funding available as well. There's also funding through other programs. So if you're part of NIHB for First Nations and Inuit patients, if you're part of Veterans Affairs, FNHA, which is for Indigenous individuals in BC, and the Canadian Armed Forces, there is some coverage for shingles vaccine also. And I mentioned earlier that RSV can be a little bit more complicated than some of the other vaccines because RSV is still a relatively newer vaccine category compared to some of the other vaccines. The coverage for it is still growing. But it is growing in some of these provinces. I've listed them here. It's not covered in every single province so far. And as you can see, even the ones where it is covered, there is limited coverage. So it's usually only given at no charge for individuals living in long-term care homes or in group settings or experiencing homelessness or other high-risk criteria. But I definitely, and Bill mentioned this earlier, in terms of even if these vaccines are not covered for you, there are still, as you can see from this slide compared to my previous slide, they don't exactly line up in terms of the ages, right? So what I'm trying to say is even if the vaccine is not publicly funded, that doesn't mean that you're not recommended to receive it because we have evidence from the trials of these vaccines. We have evidence and guidance from experts and from NACI and the Canadian Immunization Guide that do recommend individuals to consider these vaccines at the ages listed on this slide. So with that, Bill, that's kind of my spiel for the slides that I prepared. I'm happy to answer any questions that you may have or the attendees may have.
Good. Well, thanks, Molly. And that's a great overview. And by the way, there is a chart that you and I have that shows a little more detail on some of the availabilities of the vaccines, and we'll be putting that on our CARP website under the vaccination head in the next few days. So people will be able to go online and look at their province and see where it is right now. And of course, as I'll mention later, one of the things that CARP is strongly advocating for is that governments cover all those 5 vaccines and make them available to everybody for whom they're expertly recommended. One of the things that people don't always understand is how do provincial governments actually make their decisions on what vaccines they'll cover, and perhaps you could comment on that, Molly, and I will too. But that's a common question: why, when I live in Newfoundland, don't I get the same vaccines that they're able to get in Saskatchewan?
Yeah, no, it's a really good question, and one that we get from patients all the time as well. And it can be really confusing when you're looking across Canada because there's such variation. I'll speak from a clinical perspective, and Bill, you can chime in from the other policy perspective.
Right.
Usually, you know, and I think everyone here, especially across the pandemic, has become familiarized with a group called NACI. So NACI, what they do is they're a group of vaccine experts that will take in the data that the manufacturers of these vaccines will submit based on the trials that they've done to look at how effective the vaccines are, how safe the vaccines are, and how they should be used. And NACI, from a national level, federally, they will take a look at this and make recommendations, which many of us have heard on the news over the past few years on how these vaccines should be used. NACI, their role is essentially to guide provincially, because our healthcare is administered provincially, how these budgets from these provincial governments should be used to best protect our populations. And obviously, you know, it may not be one size fits all from a provincial perspective, depending on the population and that the needs of that group. And that's why we see some of the variation there.
Yeah, governments certainly make NACI, which for those who don't know is the National Advisory Council on Immunization, and that's a professional government group that we all depend on for this information, but the provinces are not obligated to follow their recommendations. CARP, of course, believes they should, that if we have these top experts in the country saying these are the vaccines people need, why wouldn't every province follow the recommendations? They don't, and that's where CARP's advocacy comes in. And as I might mention more than once during our conversation, the best way to get our provinces to do that is for you, the people who are watching today, to call your elected member of your provincial legislature and tell them that you as a voter want this to happen. Because although Molly and Anthony and I can talk at all we like at this level nationally, when politicians hear from voters, people actually vote for them, that's when they really pay attention to an issue. So we urge you all to do that. I think there are two basic questions that I'd like us to talk about before we get into the specifics from Anthony. And the one is, we talk a lot about vaccines protecting us, but Molly, can you tell us a little bit about how does a vaccine of any kind actually protect us? So you give me this jab, it comes into my bloodstream or wherever it goes. How does it really protect me?
Yeah, that's a really good question, Bill. And so the way vaccines work is, the point of getting vaccinated is to prepare our immune system to fight off infections from certain bacteria or viruses. There are different types of vaccine technology, you know, some, as we saw recently, mRNA, there's polysaccharide vaccines, conjugate vaccines, there's different types, but overall what vaccines do and how they generally work is by, through the vaccination, introducing a harmless part of the germ or something that mimics that germ into your body in order to teach your immune system to recognize it, so that after you're vaccinated, when your body comes across that bacteria or that virus again, your immune system is able to quickly recognize it right away and fight it off. And, you know, we talk about this all the time, but vaccines help protect us from that process. But the reason why we have some of these public health targets for vaccination rates is that we want to achieve something called herd immunity. And herd immunity means that if there's a sufficient amount of individuals in a population that are vaccinated, the infection is then not able to spread, right? Because then these individuals are protected. They can't get the infection. They don't pass it on, which means by getting vaccinated, we not only protect ourselves, but also those around us. And as I talked about earlier, this is especially important individually if, based on your age, because as we talked about, with aging, your immune system will also wane. But it's also important if you have contact with other high-risk individuals like infants, their seniors, people with weakened immune systems. So we get vaccinated not just to protect ourselves, importantly, but also to protect those around us.
Now, that's one of the messages that CARP has been trying to get across to all ages, all demographics, is that you're not just protecting yourself, but you're protecting the people around you. And what we encourage is anyone who has contact with the older, with seniors, the older population, should get vaccinated, because by doing that, you protect not only yourself, but them. And if you don't feel that you need the protection, that if you get that particular disease, you can fight it and you're young and strong, well, maybe you can, and that's up to you. But if you pass it on to an older person who can't do it, you bear the responsibility for them getting that particular malady. So it is important that we encourage everybody. And Molly, immunization rates are not very good in Canada at the moment, are they? I mean, one of the reasons we're talking about this today is that surprisingly to some of us, the rates are really low.
Yeah, certainly. It was a little bit, immunization rates for routine immunizations were a little bit better pre-COVID, but ever since COVID, when we had those lockdowns, we had whole cohorts, years, where these individuals who were eligible for publicly funded routine vaccines weren't able to get them. And our catch-up programs just haven't been able to catch up with the full volume of patients that were not able to receive that. If we look at COVID alone, I believe that only this might be from September, October, but at that time frame, only 18% of individuals had been vaccinated up to what was recommended, right? So only 18% had been vaccinated at the intervals that were recommended by public health at the time. And we know, especially with older adults, that they're at highest risk. So we want to make sure that they're protected in advance of this respiratory season.
Right. The one other question I have before we get to the ones that Anthony has is a very common one, but it's how safe are vaccines? Can I trust them? We hear a lot of frank nonsense about vaccines. What can we tell our viewers about the safety of vaccines?
Yeah, that's a common question that comes up as well, and I definitely understand, in terms of getting multiple vaccines over the years and different vaccines that come up in newer vaccines, that sometimes patients have a little bit of hesitancy and just trying, or maybe not hesitancy, but just wanting to understand what the contents of vaccines are and what they do. In terms of safety for vaccines, we know from, decades of data that vaccines in general are very safe. Right. Oftentimes when people talk about the long-term effects of vaccines, the main long-term effect of vaccines are the long-term protection that you get from your immune system being activated, right? And that's the intended long-term effect of a vaccine. Some of the short-term side effects of vaccines include the soreness, feeling malaise, feeling fatigue, feeling a little bit sick. And that's where sometimes individuals might think that, oh, the vaccine made me sick, or the vaccine, I got that infection from the vaccine. For the majority of vaccines, we're not using live virus or bacteria. There are some live vaccines out there, in which case definitely speak to your healthcare provider if you have other questions or if you're getting those, but those are still safe because they are weakened versions of the virus or bacteria. In terms of the side effects, what I mean to say is that the side effects are a demonstration of your immune system actually responding to that vaccine, right? So what you're feeling a little bit sick because your body is actually identifying that that harmless piece of the germ that we want to be protected against, and building that immune response in a smaller way so that the next time it can be primed to do that. So of course, I do want to say, in fairness too, when we have like some of these large vaccine programs where we have millions, if not billions, of people getting vaccinated for COVID, there are extremely, extremely, extremely rare situations of some of the side effects that come up. However, those are extremely rare. If you take a look at the risk versus benefit of protecting yourself and your family against COVID or against some of these harmful respiratory illnesses and other vaccine preventable diseases, it is a very clear answer.
Good. Well, thank you. That's good. And Anthony, I know there's a slew of questions there, and can you get to some of them for us today?
Sure. Thanks very much, Bill. Now, one of the themes in the questions is regarding the improvements that vaccines have made over the years. So if someone got a shingles vaccine 10 years ago, or they got one of the earlier pneumonia vaccines, what should they be doing now that there are new and improved versions available to them?
Yeah, that's a really great question. And, I mentioned earlier that NACI, those guidelines are always updating. And because every year we're getting new vaccine products or new treatments in general, right? Medicines, vaccines included. And that's a good thing because as our technology continues to improve, there are some of these new products. It does depend case by case in some of these scenarios. Like, for example, if you got your shingles vaccine several years ago and you're thinking about whether or not you need another dose, it depends on which vaccine you specifically got. So if you got the Zostavax vaccine, which is a different product, then you definitely do want to update with the Shingrix vaccine now, because Shingrix has been shown to have over a decade of effectiveness, which goes beyond what Zostavax, the previous product, had. It is more effective. In terms of pneumococcal vaccines and some other vaccines, with pneumococcal vaccines, many individuals might have received Pneumovax in the past, or they received both Pneumovax and Prevnar 13, which is the previous Prevnar product. In those situations, since we do have Prevnar 20 and Capvaxive available now, I would recommend, if it's been over a year, minimum 1 year, or if it's been over 1 to 5 years of you having previously received Pneumovax, I do recommend updating with Prevnar 20 or Capvaxive, because the difference between Prevnar 20 and Prevnar 13 is that addition of 7 other serotypes that the vaccine is protecting against. So we do want to make sure that you are getting that expanded protection from these new products.
Great, great news. We get lots of our members and lots of older adults who say, I've got a great immune system, I never get sick. So can you talk a bit about why we talk about the importance of vaccines for older adults, even those who are very healthy?
Yeah, that's a great question as well. I think there's a lot of patients that we see across our pharmacies, and I have these conversations with our pharmacists all the time on how to the reasons why older individuals should prioritize immunization is even if you're healthy. And the slide that I presented with the ages, where it was pneumonia age 50 plus, RSV age 50 plus, shingles age 50 plus, those are all ages based on healthy adults, right? So if you have comorbidities, those ages might even be different for you, or you might want to consider earlier.
That's a word you've used a few times. What are comorbidities? What does that
yes. Thank you, Anthony. So comorbidities, I apologize for not explaining earlier, but comorbidities would be other medical conditions that you have. So for example, if you have diabetes, or if you have high blood pressure, or if you have other medical conditions that you're taking medication for or not taking medication for, those are all risk factors that will increase your risk for some of these vaccine preventable diseases. As you age, all of these risk factors make up that perfect storm to increase your risk of severe infections and what's called complications. So basically complications would be, if you have a severe infection and then it leads to other infections, or it leads to hospitalization, it leads to those downstream effects. So we want to prevent severe infections and complications. And those risk factors, regardless of, if you feel that you are relatively healthy, even an aging immune system, even your aging lung tissues and your organ tissues, those are all factors that will impact how well you're able to fight off diseases, whether or not you have other medical conditions or whether or not you're quote unquote healthy or unhealthy. And as we talked about before, as you have those more severe infections with age, you might be healthy now, and so you might not be worried about getting COVID. But after getting COVID, you don't know what could happen. You could get a severe infection, and with that, you start that cycle where each time you may never be the same from when you were previous to that infection, right? So we're not always just worried about that acute infection. We're not just worried about, those 2 weeks where you're down and have to stay away from everyone. We're worried about that long-term effect on your body, your organ systems, and your overall immunity and health.
That leads into another question that was coming through a number of times about long COVID. So what's the latest news on that sort of tail that can come once you have a COVID infection?
Yeah, I'm glad you bring that up because, as the pandemic has progressed, there's been a lot of new information that we've learned, and we know that for individuals, I believe the latest stat is that up to 17% of individuals will experience long COVID. And with long COVID, we're looking at over several months where you have those continuous symptoms, and those could be coughing, that could be extreme fatigue, it could be the head fog and all of that, right? So over 17% of individuals, and it could be even higher represented in older adults where you have that weakened immune system response. But those individuals experience long COVID for months or more. And in those individuals that experience long COVID, in a survey, it was actually found that over 50% of people that experience long COVID actually report that it impacts their activities of daily living, and it really impacts their life, right? So, yeah, as mentioned before, it's not just about that acute infection. It's not just a cold, right? It's something that we can prevent and it'll protect you in the long term. We definitely want to make sure everyone here is protected.
That goes right into the next top question, was about the guarantees that come with vaccination. So even though you get vaccinated for COVID or pneumonia or shingles, there's still a chance you could get those conditions. What's the gamble in not getting it versus getting it, and the outcomes?
Yeah, that's difficult to say the exact gamble you'd be making. Of course, with every single vaccine that's out there, there is no 100% guarantee that you'll never get the condition. Usually, with each product, how the clinical trials look at it is when they test out the vaccine, let's say, they'll have different groups. So they'll have one group that gets vaccination and they'll have another group that doesn't get vaccination. And over time, it could be 1 year, it could be 10 years. They'll examine the rate. So how many people in each group actually ended up with that infection or condition. So with each vaccine, there are various percentages in terms of how effective they are. And those can vary from, 40% sometimes all the way to sometimes like up to 100%. So what I would say is that even if you're not going to be, even if you get a vaccine and you're not going to be 100% guaranteed protected against any sort of infection, that vaccine can still protect you from the more severe types of infections. So with COVID, you may still, after getting the COVID vaccine, you may still get COVID, but you never know if you didn't get the vaccine, how severe it could have ended up. Could you have been in the hospital in ICU? Could it have impacted you? Could you have gotten long COVID? And that's where, we want to take as many steps as we can to protect ourselves, right?
And we've heard the same when we've discussed influenza vaccines and shingle vaccines, that even if you do contract the virus or the infection, it can lower the severity of those, and particularly the knock-on effects later on.
Yeah.
And the other question on that was, how long do these vaccines last? We know that we are being asked to get COVID boosters on a regular basis and flu shots every year. But when we were children, it was sometimes a one and done. So how do we know how long they last?
Yeah. It's not a one size fits all for all vaccines, which you alluded to, Anthony. And, as throughout our lifetimes, we'll get various vaccines where you might have to get them very frequently every year, like for flu. We're still, in terms of the long-term efficacy data for COVID vaccines, that still continues to develop. The reason why we need to get more frequent COVID vaccines as opposed to some of these other vaccines is what we see with COVID is that it mutates a lot, right? So what happens with COVID is that in its genetic code, there are changes, and those changes can make it different. And that's why we had Delta, that's why we had Omicron, and that's why we had different variants of COVID, which is why we've had to update the vaccines to be able to target these new variants to make sure they're still as effective. With COVID, we're seeing that, that protection wanes usually after that 6-month mark, which is why the recommendations are around, after if it's been over 6 months, you definitely should consider getting that next COVID vaccine that you're eligible for. But then on the other side of the spectrum, we have other vaccines, or for example, as I talked about with shingles vaccine, where we have over 12 years of very strong effectiveness data, right? So that means you don't need to get a booster for those vaccines. If we're looking at Prevnar 20 or Capvaxive right now, there's no recommendation to get a booster in the future. Now, there might be new products that come out in the future that you may want to update with, but for now, it's one and done. And then for RSV, because these are still newer vaccines, that data is still being developed, right? So for example, when Shingrix came out years back, we only had that limited amount of data where we knew it was effective for 3 years or 5 years. But now with every year that goes forward, we have those ongoing trials that continue to develop, and that's where we get that long-term data for that long-term protection. With RSV, we have at least 3 years for Arexvy and at least 2 years for Abrysvo.
Bill, when it comes to out-of-pocket expenses for healthcare, Canadians presume we have a universal system, and when we go to the doctor, they take care of us, and we often walk away without cost. But not all these vaccines are covered, and I get a sense that for Canadians, they think if it's not covered, then it's not really necessary. It's just maybe a nice to have. What do we say to our members who are in many cases are asked to go out of pocket?
Yeah, well, it's just because the government doesn't in your province doesn't recommend it doesn't mean you should be getting it. We really
doesn't mean they don't pay for it. It's still being recommended.
Even though they don't pay for it, and even though they might not be promoting it as much as we would like them to, those, as we say, expert recommended, which is NACI, the National Advisory Committee on Immunization. If we can trust them. We know what their background. We know that they are practicing physicians and professionals from across the country who have examined these and have absolute proof that by getting these vaccines, we can prevent the disease in ourselves and others, and as you said, in some cases, even if we get it lessen the effect. Governments, do we believe everything that government says? I don't think many of us do. So we shouldn't believe everything they indicate, because frankly, often it's simply a financial decision that's being made. Vaccines are expensive, and even though we can prove that by giving people vaccines will save money in the long run in terms of healthcare later on, the practical answer is in most provinces, vaccines are given by public health, and public health is funded entirely separately from the care that we get in hospitals and other parts of the system. So for the people working in those areas, the public servants, saving money in one area doesn't necessarily mean it's going to automatically be spent in the other. So using that financial argument is usually a no go with governments. What CARP says to them is, do you want seniors in your province to lead healthy, productive lives and until the end of their lives, or do you want them to suffer because you didn't give them the vaccine? That's the real question, and that's the message that we'd hope all our members would be giving to their elected representatives.
And I think of it as even if it costs money out of pocket where you live, just the opportunity to keep yourself out of those ER endless waits, the hallway medicine, the shortage of doctors. Our system is not prepared for this wave of baby boomers that everyone has known has been coming. And when we have outbreaks of COVID or influenza or other respiratory illnesses, the ERs fill up.
Yeah,
So maybe to you and Molly, just on the best way to protect ourselves from that ER
you're absolutely right. And any of us, hopefully many people watching today have not had to spend time in those emergency rooms, long waiting lists. But I know you have with your family. I have personally 14, 18 hours waiting for care. If one little jab that cost me $100 will stop me from having to do that again, I'd pay that in a minute. I would have given them $100 to move to the front of the line in that 18-hour visit. The unfortunate thing is not everybody can afford those because to many people the $30, the $40, the $100 cost for a vaccination is something they just can't afford, and it's just unconscionable to us that governments would somehow not step up to the plate and pay that money rather than having their citizens go through that kind of pain and suffering.
And if the ERs are full of people with COVID or influenza or RSV, the seniors who are in need of acute care based on other conditions, some of those ones you talked about, Molly, then the entire system gets bottlenecked because of something that is preventable.
Yeah, the capacity of our system is so important, especially as we are reaching some of these high volume times. And I don't think there's anyone on the call that would like to be in this situation, of course, during the holidays where we have overwhelmed ERs coming up.
Yeah. And then Bill, maybe whenever we put out these messages about vaccinations, we talked about those anti-vaxxers or the people say nothing for me. There's a lot of internet chatter and what's happening down in the States, perhaps, where that voice is getting louder. Can we talk a bit about dispelling some of those myths so that we are talking on the same from the scientific background?
Well, it is, and it's it's so unfortunate that the people who talk that way may honestly be very concerned about other people making decisions for them and they don't want somebody else to tell them what to do. But the fact of the matter is, whether or not they want to protect themselves, if they don't protect themselves and they get these diseases, they're going to pass them on to other people, including seniors in their lives. And I know very, very few people who don't have some contact with older adults in Canada at some point. So if you don't do it for yourself, do it for your family, friends, and the people around you, your social circle, and make sure that you're protecting them, and not because you're a tough young person, not getting it yourself, but passing it on to other people.
And I already spoke about this earlier, but in terms of the safety and effectiveness of the vaccines, there's such a wealth of information, even with COVID vaccines that have just emerged within the past few years. Since the start of COVID, there's been over 100 million COVID vaccines given in Canada alone, right? So we have such a wealth of information and evidence supporting the safety of these vaccines.
Bill, is there a bit of age discrimination when it comes to these payment programs? That we're getting questions about the shingles stopping at 75 or at 70 or RSV. What's the lot? Is it just a numbers game for the provinces right now?
First of all, it's different from province to province. So that question came from somebody in Ontario, where there's just a narrow window of 70 to 60 to 670, and then 70 to 75, where people can get the vaccine. Other provinces do cover it for 65 and over. Other provinces don't cover it all. Other provinces, like the one I live in, it was promised by the recently elected government here that they would fund it. So we're going to, CARP in Nova Scotia will hold their feet to the fire for getting it in this year's budget, so it's covered right away. But the fact is, it's different, and as I said earlier, the decision doesn't seem to be being made in order to find the best way to treat our older population. It's made for other reasons: convenience, financial concerns, or just a lack of understanding of the impact on people's lives. And it certainly is ageism when governments choose certain categories and not others based simply on age. The recommendations that are made by NACI and people like Molly and others is that there are certain ages for each of these diseases where you're at much higher risk, and there are vaccines that are aimed just at your age group, and they should all be available to the people who need them, not based just on the fact that they're one age or another.
Well, Bill, I'm just looking at the clock here, and I think I've got most of the themes out of those questions, and we certainly will encourage people to continue to send us questions about this topic. But over to you for perhaps some final words and sending our thanks.
Molly, do you have a final message for anyone?
No, I think, we've gone through a lot today, and I don't want anyone in the participants, the attendees tonight, to feel overwhelmed over, some of the volume of information we went through, or the number of vaccines you may have to, or you're recommended to receive. What I would say is definitely, have a good connection with your local pharmacist, with your healthcare provider, and really, you kind of have to be your own advocate sometimes too, especially in the vaccine space. Sometimes this falls into a space where we're not sure as to, is it the pharmacist that's making these recommendations or the physician? And so sometimes there's that lack of communication between the healthcare team. And so that's why these sessions are so important, so that, you as being the individual patient is well informed and can advocate for yourself, both from a policy perspective and also speak with your healthcare providers on seeing what's the best choice for you, when to schedule these vaccines, when to be best protected from them. The one thing I will say too, as well, to avoid any confusion, especially for those in certain provinces like Ontario, some of these publicly funded vaccines, if you want them publicly funded, they're not available in the pharmacy. So you'll only be able to get, for example, RSV, shingles, or pneumonia if they're publicly funded at the physician's office. If you get them at the pharmacy, you will have to pay or use private insurance for them. And so that's definitely something else to speak about as well. Obviously, for flu and COVID, it is publicly funded in pharmacies across Canada.
Right. Well, certainly, and that, Molly, that's one of the things that CARP has been advocating for in all provinces, especially in Ontario at the moment, and that is that the scope of practice for pharmacists be widened, so you don't have to wait those months to see your doctor, if you're lucky enough to have one, to get your vaccines, that you should be able to get them, as you can in many provinces outside of Ontario. You can get them directly from your pharmacist. And I think that's the other thing that I will say, because you're a pharmacist and maybe not comfortable in saying it out loud, but we know from that survey that I just quoted, I know from my years as CEO of the Lung Association and dealing with parents, we get with patients, we get a tremendous amount of information from our local pharmacist. And to go and talk to your local pharmacist, if you have questions following this webinar today, that's the easiest person to contact and get the answers that are right for you. Your pharmacist knows your history, knows the other meds that you're on, and is able to give you good advice. And so if you can't see another health professional, the pharmacist is the best to speak with. And I would only finish off today before thanking Molly is to say that once again, the best way that we can get in your province the rules changed so you can get the vaccinations you need at no cost to you is for you to talk to your local elected representative and tell them that you, the person who votes for him or for her as a voter, you want these things, these 5 vaccines covered in your province. And that way the 240,000 voices of CARP members across the country will be heard loudly and clearly in each of those provincial legislators. And that's when we'll be able to be effective in the long run. End of sermon there. I want to thank very much Molly Yang, a pharmacist, a leader, an educator, an award-winning pharmacist, I'd say. Really appreciate your time today, Molly. I know you dove into this after being out of the country for a length of time, so really appreciate you doing it. And thank you, everybody, for watching. We will be sending you an email of where you can see a recording of this program in the very near future. So thank you, everyone.
Thanks so much, Bill. Thanks, everyone.
Thanks.